Pharmacological treatment for pain or treatment using drugs or medications. First, we're going to talk about NSAIDs or non-steroidal anti-inflammatory agents. So NSAIDs are the most commonly prescribed drugs for pain. They're also available over the counter. So mechanism of action. Remember, there are many different kinds of NSAIDs, but mainly it acts in the arachidonic acid pathway, which the body uses it as a starting material in the synthesis of prostaglandins and leukotrienes or inflammatory mediators. Also, they block the cyclooxygenase or COX and prostaglandins, thus decreasing the inflammation and pain. So NSAIDs relieve pain, headache, and inflammation by blocking the chemical activity of the enzyme called COX or COX, which promotes synthesis of prostaglandins, so it's a lipid compound with hormone-like effects involved in the inflammatory process. The therapeutic effect of NSAIDs include decrease in inflammation, decreased pain, and decrease in body temperature. So it's also considered antipyretic. In addition, as we already learned, it's also, depending on which one we're talking about, mainly aspirin, it's a platelet aggregation inhibitor. Indications for NSAIDs include inflammation, so it's for usually mild to moderate pain, fever, rheumatoid arthritis or osteoarthritis and or gout, and disorders due to platelet aggregation such as cardiovascular disease, peripheral disease or PVD. And for these specific ones, mainly we use aspirin for its platelet aggregation inhibitor properties. So precautions and contraindications. Obviously, known drug allergies and conditions that place the patient at risk for bleeding, including vitamin K deficiency and peptic ulcer disease. And also, we have to remember that NSAIDs can counteract the effect of aspirin. There's also a black box warning regarding thrombotic events and MI and stroke. Also, precautions in GL ulcer, perforations, bleeding, and renal function, especially with decreased creatinine clearance, as this medication can make them worse. Motrin are also known as ibuprofen. So Motrin is the brand name and ibuprofen is the generic. We have to be careful with using it together with aspirin. Definitely Motrin or ibuprofen is not used as a substitute for aspirin as a platelet aggregation inhibitor. Also, one thing to remember is that aspirin is contraindicated in children with chickenpox due to Reye syndrome. So Reye syndrome is basically swelling of the brain and liver, causing some damage, and it's linked to the use of aspirin to treat the viral illness such as flu or chickenpox. So with children, we don't use this. Instead, we use acetaminophen instead. Obviously, if somebody has documented aspirin allergy, we want to make sure that we don't give them any other form of NSAID, as there can be cross allergies. Some side effects. So these are more favorable adverse effects compared to corticosteroids. So they're there, but usually it's less than what patients would experience with corticosteroids. So again, black box warning, it can increase thrombotic events such as MI and stroke, and as well as ulcers. So for somebody with existing ulcers, it can actually make it worse, and it can cause some perforations, and it can definitely decrease renal function. So decreasing renal function, so if we look at it in a labs aspect, it can increase your creatinine and your BUN. Additional side effects, specifically aspirin related, nausea, vomiting, and tinnitus, so ringing in the ears, respiratory depression, hypotension, hypoglycemia. It can also cause metabolic acidosis and respiratory alkalosis. Some nursing actions when giving NSAIDs: definitely assess for therapeutic effects or lack thereof, as well as side effects. Also remember that the dose of Motrin or ibuprofen, so we want to make sure that you guys remember this, the maximum dose, depending on what you're using, what reference, but for this specific class, if you're asked what's the adult maximum dose of Motrin or ibuprofen, it's 3.2 grams in 24 hours. And the primary organ that's affected when it comes to Motrin is renal due to the prostaglandins. So it's also important to take in consideration the effect of Motrin or ibuprofen together with aspirin. Again, that can cancel the effect of aspirin in preventing thromboembolic events, as Motrin or ibuprofen is known to increase the risk of thrombotic events. Examples of drugs in this class include aspirin, or known as ASA. So there's many different NSAIDs, but the most common ones, obviously aspirin or ASA, Motrin or ibuprofen, so that's the most common one, and it's also available over the counter depending on what dose we're talking about. Also, naproxen or naproxen is the second most common, and then we have Toradol or ketorolac. This medication specifically, what you have to know is often just used short term, so within 5 days, because of its effects on the GI tract and kidneys. So this can cause severe GI and renal effects, and that's the reason why it's mostly used short term, and it's often seen being used after surgeries related to any musculoskeletal issues. Some other medication that you will see prescribed, and this is more for longer term, is Voltaren or diclofenac. It's available in PO as well as topical. In addition, another medication that you have to remember is the cyclooxygenase 2 or COX-2 inhibitor, known as Celebrex or Celecoxib. This specific one is also an NSAID, but this specific one blocks the chemical activity of the enzyme called cyclooxygenase or COX, which promotes the synthesis of prostaglandin. And so this one is involved in the inflammatory process. So therefore, by blocking it, this decreases inflammation. This medication is known to have less GI effects, but it does increase the risk for cardiovascular effects.